A new report from the American Cancer Society out this month says that younger women are being diagnosed with breast cancer at a higher rate. October is Breast Cancer Awareness Month, and in this month's Eye on Health, WSBT 22's Erin Leedy has more on why annual mammograms are the key to early detection.
More than 1% of the entire U.S. population are breast cancer survivors. Catching the cancer early with a mammogram that takes about 20 minutes can add decades to a person's life.
20 years later, and Monica Santa still remembers it like it was yesterday.
July 6th at 10 o'clock in the morning, I remember. I think about it every year when it comes along.
It's the exact moment she learned she had breast cancer. Monica started getting yearly mammograms 6 years prior at age 40 at the urging of her colleagues. After all, she worked as an image coordinator in the breast care center at Beacon Health System, the same department in which she would soon become a patient.
It was the best place to work and the best place to get sick at, if that makes sense, because they took care of me and I could talk from my experience.
Breast cancer didn't run in her family and only showed up on a mammogram, not in a self-screening.
I couldn't feel it. The nurse couldn't feel it when I had my monthly exam.
Monica underwent radiation and has since been cancer-free. Discovering it early greatly improved living to tell her story.
If we do detect cancer early, we are talking about a 99% survival rate. It is one of the greatest success stories in medicine.
Dr. Samir Patel, a radiologist at Beacon who diagnosed Monica's breast cancer, says she started getting mammograms at the right age. He actually wrote a paper in 2018 in the Journal of the American College of Radiology in which he looked at more than 450 breast cancer patients in Michiana to see how often they were getting mammograms and to compare the results.
And the data was very stark. It showed that if women got a mammogram every year, their risk of dying from breast cancer was reduced by 40% compared to women if they went every other year.
Dr. Patel says some women younger than 40 with a strong family history of breast cancer or have a gene for breast cancer should start getting mammograms at the age of 30. But he says no matter what age, simply don't put off getting one.
Most women that actually come to get their mammograms will not have a diagnosis of cancer. If 1,000 women undergo mammography, only 2 to 8 of those patients will have breast cancer.
As for Monica, she now volunteers her time during retirement at the very place that changed and saved her life.
What a journey it has been. Because I got my mammogram. I get real emotional over it.
Now, in addition to self-screenings and yearly mammograms, Dr. Patel recommends women maintain a healthy lifestyle through diet and exercise, not smoking, and limiting alcohol consumption. In the studio, Erin Leedy, WSBT 22 News.
And we've posted the full interview with Dr. Patel on the WSBT YouTube page. He also talks about the common misconceptions surrounding mammograms, which demographic is more at risk for cancer, and the advanced technology that Beacon uses to detect breast cancer.